Urinary tract infections, UTIs, develop when bacteria invade the urinary tract, usually getting into the bladder or urethra. Up to 60% of women will battle a UTI in their lifetime, with recurrence common. Antibiotics remain the first-line medical treatment, but increasingly drug-resistant superbugs make home remedies an attractive option, either alongside medication or for mild infections without complications. Classic UTI symptoms typically include a persistent urge to urinate, burning and stinging during urination, foul or strange-smelling urine, pelvic cramping, pressure, and discomfort. Sometimes low fever, chills, nausea, and vomiting occur if the infection spreads to the kidneys. While prompt antibiotic intervention helps prevent kidney damage from an advancing infection, not all UTIs require pharmaceuticals. In females especially, the short urethral opening near sources of contamination, like the rectum, allows bacterial ingress more easily into the bladder, particularly with sexual activity. Other common causes include pregnancy, urinary catheters, diabetes, or physical blockages, preventing complete bladder emptying. However, even with an identified cause, some women suffer chronic repeat infections following antibiotic therapy. This points to an underlying imbalance or immune vulnerability antibiotics fail to resolve long-term. Taking steps to avoid initial infection or recurrence through lifestyle adjustments like sanitary bathroom habits, urine pH balancing, stress reduction, and now utilizing targeted natural interventions makes sense. Numerous herbs, nutraceuticals, and homeopathic remedies exist that deter harmful bacteria like E. coli from attaching to the bladder lining while providing anti-inflammatory, antiseptic benefits without gut flora destruction or yeast overgrowth issues associated with antibiotic overuse. Let's explore the top botanical choices to keep on hand for resolving uncomplicated lower urinary tract infections. Here are 10 best home remedy for urinary tract infection. 1. Increase fluid intake. Perhaps the simplest home remedy anyone can immediately put into practice involves increasing fluid intake, particularly water and unsweetened herbal teas. Drinking more washes bacteria from the urinary tract before they latch on and multiply, while promoting frequent bathroom trips that flush contaminants before infections establish. Shoot for at least 64 ounces of total fluids daily. Pure cranberry, blueberry, or lingonberry juice contains biofilm-reducing compounds preventing bacterial docking as well. Just limit sugar content. 2. Take D-mannose supplements. Numerous clinical studies validate using D-mannose supplements to treat UTIs by binding to E. coli's adhesive glycoproteins, preventing the bacteria from clinging to the bladder walls. The antioxidant D-mannose passes harmlessly through the body in urine without altering intestinal bacteria the way antibiotics do. For mild symptomatic relief without complications, take 500 milligrams 3 times daily. Increase to 1,000 milligrams for acute infection alongside increased fluids. Taper dosage once symptoms resolve. 3. Increase vitamin C intake. Besides being a potent everyday immune booster, vitamin C's acidic nature helps reduce urinary pH below 6, lowering bacteria survival. Supplementing 1,000 to 4,000 milligrams per day may resolve mild cystitis. Concentrated camu berry or acerola cherry powder beats synthetic ascorbic acid that may irritate an inflamed bladder. Or simply eat more oranges, bell peppers, dark leafy greens, broccoli, and strawberries in your diet when fighting infection, and to prevent recurrence by bolstering antioxidant status long-term. 4. Take anti-inflammatory herbs. Soothing herbs like aloe vera, calendula, and turmeric provide anti-inflammatory relief from painful UTI symptoms without antibiotic side effects like yeast infections or gut flora wipeouts. Avoid capsules and tablets that could further irritate bladder tissues. Instead, use oral tinctures, tea, broths, or add the whole herb spice to foods. Turmeric blended into non-dairy soups and marinades fights inflammation while stimulating immunity against invading bacteria. Stay hydrated for any herbal adjuncts to properly flush through the urinary tract. 5. Drink herbal teas. sipping turmeric, ginger, nettle leaf, corn silk, juniper, rosehip, dandelion, or UVA ursi, bearberry tea, several times daily, provides anti-inflammatory relief from UTI pain and bladder cramping while fighting infection. Goldenrod, horsetail, couchgrass, and buchu also increase urine flow. Most herbs work best in combination for a synergistic effect. Blend small portions of dried loose herbs into a reusable infuser. Allow to steep 10+ minutes covered. Sweeten with a touch of raw honey if needed, or flavor with citrus. Number 6. Try probiotic supplements. Oral probiotics boost populations of protective good bacteria in the urinary tract that compete with and crowd out infectious strains attempting to colonize. Look for multi-strain products specifically geared for urogenital health, dominated by lactobacilli strains that mimic the vagina's microbiome, like Lactobacillus rhamnosus GR1 and Lactobacillus reuteri RC14. Take daily for several weeks as prophylaxis, or at the first hint of infection to prevent bladder colonization until symptoms pass. 7. Use heat therapy. Instead of ice packs, apply gentle heat to the abdomen, lower back, and pelvic region for relief when experiencing acute UTI pain and bladder pressure. The increased blood flow aids circulation of infection-fighting white blood cells and nutrients while relaxing muscle tension. Experiment with heating pads, hot water bottles, warm baths or showers, warm compresses, wheat bags, rice socks, or steamed towels. Avoid direct skin contact over 15 minutes to prevent irritation or burns. Number 8. Try biofeedback techniques. Mindfulness meditation, diaphragmatic breathing exercises, guided imagery, and progressive muscle relaxation prompts help quell the bladder nerve triggers exacerbating urgent, frequent urination. Quieting central nervous stimulation gives antibiotics or natural anti-infectives space to work while alleviating painful spasms. Yoga poses like bridge, child's pose, or legs up the wall also relax pelvic floor tension and anxiety, further aggravating symptoms. Be patient, finding biofeedback methods suiting your personal needs. 9. Wipe properly. Always wipe front to back thoroughly after using the bathroom. In females especially, this avoids spreading fecal matter towards the shorter urethral opening near the vagina where contamination can enter. Always urinate, cleanse, and change undergarments following intercourse, which dislodges bacteria. Avoid irritating soaps, bubble baths, douches, scented toilet paper, or menstrual products. Rinse external genitalia with pure water or a soothing herbal wipe when you suspect infection to help flush contaminants before they ascend into the urethra. Number 10. Stay alert for advanced symptoms. Carefully monitor all UTI symptoms for indications a more serious kidney infection is developing, requiring urgent medical intervention. High fever, shaking chills, flank pain, nausea, vomiting, and mental confusion suggest bacteria reached the kidneys, potentially causing permanent damage if left untreated. Low urine output, bloody or brown urine, also warrants immediate evaluation to rule out upper tract blockages needing drainage. Don't hesitate seeking emergency care with serious symptom progression despite home treatments. Better safe than sorry. Employing natural healing alternatives for recurrent UTIs doesn't mean avoiding essential medical care when appropriate. If acute symptoms fail to quickly resolve or worsen despite conservative home care, don't delay seeing your healthcare provider for urine culture analysis and possible antibiotics if warranted based on pathogenic strains. Lingering infections may also require further testing to identify any anatomical abnormalities or embedded stones blocking urine flow, enabling recurring bacterial footholds despite sensible lifestyle corrections. However, for uncomplicated lower UTIs without fever or kidney involvement, research validates using D-mannose supplements, herbal teas, probiotics, vitamin C, heat therapy, and relaxation techniques right alongside increased hydration and proper perineal hygiene can successfully treat many sufferers, can help resolve many acute yet mild infections. Women dealing with repeat UTIs may benefit from taking specific urinary tract probiotic strains throughout any prescribed antibiotic therapy to help prevent opportunistic yeast overgrowth leading to further urogenital woes. Those with recurrent issues should also explore complementary medicine avenues. Naturopathic and functional physicians specifically help identify nutritional deficiencies, digestive issues, hormonal imbalances, or other subtle underlying triggers. Conventional testing overlooks that allow repeat UTIs to develop in those prone towards this all-too-common, yet extremely frustrating health disorder. Don't simply accept endless rounds of medications without exploring possible reasons for susceptibility. Armed with that insight, customized lifestyle adjustments and select natural interventions tailored to your unique challenges often minimize repeat infections when applied diligently alongside acute symptom management. Hopefully now you feel fully equipped selecting research-backed home remedies and integrative medicine approaches to soothe those miserable UTI flare-ups when they periodically occur. Let's recap key prevention fundamentals to apply long after acute symptoms fade. 1. Stay hydrated daily with herbal teas, diluted juices, and aim for 64+ ounces of water, more during hot weather. Urinate frequently and when you first feel the urge to avoid bacterial multiplication. Consider taking D-mannose supplements daily. 2. Avoid irritating feminine hygiene practices like douches, strong soaps, scented wipes, tampons, tight garments, and unnecessary antibiotics without confirmed infection. Instead, use gentle external washes, breathable cotton underwear, and unscented menstrual products. 3. Stick with showers over tub baths to reduce exposure to contaminants. Wipe properly front to back after toileting. Urinate and cleanse post-intercourse. 4. Incorporate urinary tract probiotic supplements into your routine, especially following any antibiotic therapy. Repeat for several weeks to restore good bacteria keeping pathogens in check. Eat fermented foods like kefir, miso, kimchi, kombucha, yogurt, and sauerkraut. 5. Don't dismiss recurring UTI symptoms as normal or untreatable. Explore subtle causes like nutritional shortfalls, medications, gastrointestinal issues, incontinence, pelvic floor dysfunction, skin conditions, diabetes, or immune impairment perpetuating susceptibility. Identify, then correct upstream triggers. 6. Finally, don't delay seeking medical treatment if you experience fever, back pain, abdominal pain, nausea, vomiting, or other serious infection indicators. Mild home care remedies revolve around prevention and gentle symptom relief, but more aggressive infections can rapidly progress to kidney damage or sepsis. When in doubt, get evaluated promptly. Stay tuned for more home care tips and integrative medicine perspectives on resolving frustrating urogenital problems like chronic UTIs, yeast infections, and pelvic pain syndromes holistically through diet, stress coping methods, movement therapy, botanical interventions, and functional nutrition approaches. Natural healing takes patience and diligence, finding your individual root causes, then incrementally addressing each one through lifestyle adjustments, but can provide lasting relief from recurrent issues that conventional medicine often merely bandages temporarily. Thanks for watching, and we'll see you in the next video.